Here are some mnemonics you could use to remember basic information about the head and neck regions. Medical mnemonics have been used forever to help students memorize details that would otherwise have become confusing. You as a medical student probably have a few mnemonics of your own. Here, I have compiled most popular and useful medical mnemonics concerning the head and neck regions. Please, if you haven't subscribed to this channel, click the subscribe button and the notification bell. Skull mnemonics. Cranial bones. Old pygmies from Thailand eat skulls. Occipital, parietal, frontal, temporal, ethmoid and sphenoid. Alternatively, you can go with step of 6. The 6 skull bones are sphenoid, temporal, ethmoid, parietal, occipital, and frontal. Cranial sutures. Learn cranial sutures. Lambdoid, coronal, and sagittal. Facial bones. Zorro likes punching my very nose in. Zygomatic, lacrimal, palatine, maxillary, vomer, nasal, and inferior concha. Now, some of these mnemonics may sound crazy and even grammatically senseless, but all we are after is how we can memorize these basic things and retain them in our memory. Punching my nose reminds one of the facial bones, of course it does. Mastoid bone, muscle insertion. Log suddenly struck my mastoid. Longissimus capitis, splenius capitis, and sternomastoid. Superior orbital fissure, structures passing through. Long fissures seem to store only nerves, instead of arteries, including ophthalmic veins. Lacrimal nerve, frontal nerve, superior ophthalmic veins, trochlear nerve, superior division of oculomotor nerve, nasociliary nerve, inferior division of oculomotor nerve, abducens nerve, and inferior ophthalmic vein. Trigeminal nerve, where branches exit skull. Standing room only. Superior orbital fissure is V1, foramen rotundum is V2, and foramen ovale is V3. Orbit. The bones of the medial wall. My little eye sits in the orbit. Maxilla, that is frontal process, lacrimal, ethmoid, and sphenoid. Foramen ovale contents. Ovale. Otic ganglion, V3 cranial nerve, accessory meningeal artery, lesser petrosal nerve, and emissary veins. Alternatively, male. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary veins. This also includes motor root of trigeminal and middle meningeal vein under M. Scalp mnemonics. Scalp layers. Scalp, from superficial to deep. Skin, connective tissue, aponeurosis, loose areolar tissue, and pericranium. Scalp nerve supply. Glass. Greater occipital, greater auricular, lesser occipital, auriculotemporal, supratrochlear, and supraorbital. Muscles of the head and neck. Pterygoid muscles function. Look at how your jaw ends up when saying first syllable of lateral or medial. Lateral, your jaw is now open, so lateral opens mouth. Medial, your jaw is still closed, so medial closes the mandible. Eye rotation by oblique muscles. Smile. Superior oblique for medial eye rotation. Inferior oblique for lateral eye rotation. Extrinsic muscles of tongue. This actually for pro soccer fans. Paris Saint-Germain's hour. Palatoglossus, styloglossus, genioglossus, and hyoglossus. PSG is a French soccer team. A foreign one as the case may be, hence extrinsic comes to mind. Face muscles. Large muscle groups. Cranial innervation. Mandibular nerve for muscles of mastication. Facial nerve for muscles of facial expression. Cricoretinoids, abductor versus adductor. When aliens abduct you, they probe you. Posterior cricoretinoids abduct, while lateral therefore is adduct by default. Hyoid bone. Muscle attachments. Currently, he doesn't show generosity much. That's obvious, Stanley. The first sentence is for 6 muscles attaching superiorly, the second sentence is for 3 muscles attaching inferiorly. Both sentences are in order from lateral to medial. Constrictor. Hyoglossus, digastric, stylohyoid, geniohyoid, mylohyoid, thyrohyoid, omohyoid, and sternohyoid. Extraocular muscles movements. Oblique leaks cause lateral rotation of eyeball. Obliques cause lateral, all other recti are medial rotators of the eyeball. Action of the obliques is opposite to their names. Action of the recti is rightly fitting to their names. Both superiors cause intorsion and both inferiors cause extorsion. Arteries of the head and neck. Carotid sheath contents. IC 10 cc in the IV. IC equals internal carotid artery, 10 equals Cn10 vagus nerve, CC equals common carotid artery, and IV equals internal jugular vein. External carotid artery branches. Some angry lady figured out PMS. Superior thyroid, ascending pharyngeal, lingual, facial, occipital, posterior auricular, maxillary, and superficial temporal. Cavernous sinus contents. O-tom cat. O-tom are lateral wall components in order from superior to inferior. Ca are the components within the sinus from medial to lateral. Oculomotor nerve, trochlear nerve, ophthalmic nerve, maxillary nerve, carotid artery, and abducent nerve. Ca ends at the level of T from O-tom. T, when written, connects to the T of O-T-O-M. Superior thyroid artery branches. May I simply suggest calling Gertrude? muscular, infrahyoid, superior laryngeal, sternomastoid, cricothyroid, and glandular. Veins of the head and neck. Internal jugular vein. Tributaries. Medical schools let confident people in. Well, actually they do. From inferior to superior. Middle thyroid, superior thyroid, lingual, common facial, pharyngeal, and inferior petrosal sinus. External jugular vein. Tributaries. Past. Posterior external jugular vein, anterior jugular vein, suprascapular vein, and transverse cervical vein. Nerves of the head and neck. Cranial nerves. Oh, once one takes the anatomy final very good, vacations are helpful. Cn7 Innervated Muscles. Imagine someone making the facial expression to say PSS while whistling. Facial expression muscles. Posterior belly of digastric, stapedius, and stylohyoid. Branches of facial nerve. To Zambia by motor car. Temporal, zygomatic, buccal, masseteric, and cervical. Bell's palsy. Blink reflex abnormal, earache, lacrimation, loss of taste, sudden onset, palsy of 7 nerve muscles, and then all symptoms are unilateral. Scalp nerve supply. Glass. Greater occipital and greater auricular, lesser occipital, auriculotemporal, supratrochlear, and supraorbital. Composition of cranial nerves, motor, sensory, or both. Some say money matters, but my brother says big brains matter more. Sensory, sensory motor, motor, both, sensory, both, motor, motor, in the order of cranial nerves starting from the optic, that is cranial nerve 1. Lacrimal nerve path. Lacrimal's story of 8 Ls. Lacrimal nerve runs on lateral wall of orbit above lateral rectus and lets communicating branch join in, then supplies lacrimal gland, then leaves it and supplies lateral upper eyelid. Trigeminal nerve relations in the skull, foramina. Standing room only. Superior orbital fissure is V1, first branch, foramen rotundum is V2, foramen ovale is V3. Innervation of extraocular motor muscles. LR6 SO4 3, LR6 lateral rectus, SO4 superior oblique by cranial nerve IV. 3. The remaining 4 are eyeball movers by cranial nerve 3. Ansa cervicalis nerves. Ghost thought someone stupid shot Irene. Geniohyoid, thyrohyoid, superior omohyoid, sternothyroid, sternohyoid, and inferior omohyoid. Cervical plexus, arrangement of the important nerves. GLAST. Remember the 4 compass points. Imagine clockwise from north on the right side of neck. Great auricular, lesser occipital, accessory nerve pops out between L and S, supraclavicular, and transverse cervical. Facial nerve branches. 2 zombies buggered my cat. Temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. From superior to inferior. Other head and neck mnemonics outside the classified regions above include the following. Tonsils. The 3 types. PPL. Pharyngeal, palatine, and lingual. Voice box. Names of parts in sagittal cross-section. There's 3 V's in the voice box. Vestibular fold, ventricle, and vocal fold. Note that vestibular and vocal cord are also known as false and true cords respectively. Horner's syndrome components. Spam. Sunken eyeballs, sympathetic plexus, ptosis, anhydrosis, and meiosis. Nasal cavity components. Never call me needle nose. Nares, conchae, metasis, nares, nasopharynx. Note that this mnemonic sentence is nasally related, so this would help better. These are the few I could compile here. If there are some other parts of this regions not included in this video, and would like me to come up with, just drop a comment down below. Also, if there are mnemonics you have come up with and would like to share here, please share on the comment section. For more videos like these, such as thorax, abdomen, pelvis, perineum, click and subscribe to this channel.